Control. The Africa Center for Disease Control reports that its medical experts on the ground are still working with the DRC's government to ensure that the cases remain minimal.
So far, 28 people have died in the outbreak that was declared in May this year. Coletta Wanjohi reports from Addis Ababa.
In the northwestern city of Mbandaka in the Democratic Republic of Congo, medical experts work hard to prevent the further spread of Ebola. This is the 9th outbreak of the deadly disease in 40 years. The African Center for Disease Control that has been monitoring the situation says of the 62 people who contracted the virus, 28 have died.
It's fair to say that we can express some cautious optimism that the situation is stabilizing, but we are very cautious with that. Remember, Ebola virus outbreak depends on just one case, so one case can very quickly become spread very quickly there. So, but we are pleased with where we are with respect to this, the new cases that we are receiving.
According to the World Health Organization, the last confirmed case of Ebola in the DRC was on 6th June. Since then, all probable and suspect cases have been declared negative. The director of the Africa Center for Disease Control recommends that more be done to empower the country's medical systems in preparation for future outbreaks.
The National Public Health Institute of that country should be able to respond to it in a timely fashion. We cannot be running into a country each time and responding and going out. Nothing tells us that when this outbreak is over in 2 months, that another outbreak will not occur in Lubumbashi, and then what do? We rush back and start doing that.
The DRC government authorized the World Health Organization to use the VSV vaccine, an experimental drug that was tried successfully in Guinea in 2015. The last 161 people to have been exposed to the Ebola virus will finish their mandatory follow-up period on 27th June. They have been under strict observation to rule out any infection. Through the work of the Africa Center for Disease Control, the continent's response to the Ebola outbreak in the DRC has been swifter than in 2014, when the Ebola outbreak hit countries in the West African region that were unprepared for such an outbreak, leading to the death of more than 11,000 people. Coletta Wanjohi, SABC News in Addis Ababa, Ethiopia.